Hi Lori, my name's Layla. I'm the student PTA who's been assigned to work with you today. Is that okay?
Yeah.
Okay. I was just talking with the therapist and going over your chart, and it looks like you had a fall about 3 months ago.
Yeah, 3 months ago.
And you broke your wrist?
Yeah.
Okay. And they put a cast on that?
Yeah, I actually just barely got it off this week. So
oh, good.
12 weeks.
Awesome. How's it feeling?
Fine for the most part. It's kind of painful where it's swollen around my wrist.
On a scale of 0 to 10, 0 being no pain, 10 being emergency room, how bad would you say the pain is?
When I'm not trying to move my hand, maybe like a 6.
A 6. Good. So, can I have you put your arm up here for me? Good. Do you mind if I touch you?
No.
Okay. So I'm just looking at the swelling. Can I have you flip it over for me? Good. Testing for capillary refill. Can you feel my hands?
Mm-hmm.
Are my hands hot or cold?
Normal.
Normal. Good. How about can you move it for me?
No, not really.
Not really?
That's about
What
it.
if you turn it around?
None? Same thing.
Okay, that's fine. What about your elbow?
Yeah, I can move my elbow fine.
Good. And your shoulder?
Yeah.
Can you do a circle for me? Good. Okay, well, are you taking any medications?
Just ibuprofen.
Okay. And are you seeing a doctor for any other reasons?
No, just my arm.
Good. And no metal implants, right?
No.
Okay. So the therapist would like to do NMES with you today. Have you ever done electrical stimulation before?
No.
Okay. So this form of electrical stimulation looks for a muscle contraction. So we're gonna put one electrode on your forearm, one a little bit further down, and what it's gonna do, it's gonna help contract that muscle. And the reason we're doing that is because muscle contractions bring blood flow to the area, and the blood flow helps to take the swelling out.
Okay.
It puts what we call lymph back into your lymphatic system and out of the tissues. So it should help reduce the swelling, and that will help increase your range of motion and decrease any pain that you're having because of it.
Okay.
Okay, so I'm going to go grab a few things and I will be right back. Do you want a pillow under your other arm?
Yeah, that'd be good.
Okay, good. Okay, I'm going to test it on your other arm just so you can kind of get an idea of what it's going to feel like, okay?
Okay.
Okay, I'm just going to clean the skin real quick. Okay, can you bring your wrist back for me? Good, and relax. Make sure those are on there good. Okay, so I want you to make sure that you're completely relaxed. So when it does contract, I know that it's the electrodes doing their job, okay? And I'm going to just start to slowly increase the intensity. Does that feel all right?
Yeah, that feels fine.
Kind of funky, huh?
Yeah.
Good. So, and it'll do that. It'll stay on for about 10 seconds and then turn off for about 30 seconds.
Okay.
So let's go ahead and put it on your other arm.
Okay.
Clean the skin really quick. It'll just help the electrodes to stick better and conduct better.
Okay.
Okay. And this is just an alcohol wipe. Might be a little cold.
Okay.
And we have chosen to use large electrodes because the smaller ones tend to be more uncomfortable won't feel anything at first, not until I turn this on. So I'm going to put one right over the motor point, right here. And the other one over this motor point, making sure that I keep one distance of electrode in between. Okay. Okay, so we're using a preset therapy program within the NMES unit. It has a ramp time of 2 seconds ramp on and 2 seconds ramp off. The preset frequency is 35 hertz, which is a low frequency, and a wide pulse duration, about 400 microseconds. And we're using an asymmetrical wavelength. Okay, so I'm going to start to increase the intensity, and it's going to, like I said, give you a muscle contraction. It might feel a little weird just at first, but you should get used to it pretty quick. But what I want you to do right now is just make sure you're completely relaxed, so when it does contract, I know that it's the electrodes doing their job, okay?
Okay.
So here we go. And you're going to feel like a tingling feeling. Good. You doing okay?
Yep.
Okay, it's going to stay on about 10 seconds. It'll go quick. Good. And then it'll be off for about 30 seconds.
Okay.
And it'll cycle on and off like that. 10 seconds on, 30 seconds off for about, we'll go about 7 to 10 minutes depending on how you do with it, okay?
Okay.
I'm going to give you this bell just in case you need me for anything, but I'll be close by. And I'm going to set this timer because this one won't buzz to let me know when you're ready. We'll set it for 10 and we may go a few after that. Okay?
Okay.
Good. So I'm going to look for any adverse reactions to the treatment, make sure her breathing is good, that she doesn't want to have skin pallor, and just make sure she's doing good. Ask her, how's it feeling?
It's feeling fine so far.
Good. Good, you're doing great. Doing really good. Okay, I'm just looking for any adverse reactions. Make sure your skin looks okay. Good. Check capillary refill. The swelling looks like it's gone down a little bit. We can take another measurement and make sure. How's the pain?
And the pain's actually gone down